It's the most common type of cancer in the U.S., and anyone is susceptible. Despite so many warnings about sun safety, skin cancer rates have doubled in the past decade. Nowhere is this truer than in Florida, where the weather is warm and many like to spend their free time in the sun. James Burns used to be one of them. After spending years soaking up Miami's beautiful beaches, he noticed a suspicious growth and got it checked out right away. The news was upsetting. James had skin cancer.
It started just as a little dot, but then it started to grow out bigger and bigger, and I went to my local doctor and they suggested I had it checked out. When I found out that it was skin cancer, obviously the word cancer, it makes you think a lot, and so I thought, wow, we need to get this taken care of.
Skin cancer comes in several forms, most commonly basal cell and squamous cell carcinomas. The good news is that both types are highly treatable. Mohs micrographic surgery is one of the most effective techniques for treating several types of skin cancer. The treatment allows for complete removal of the lesion while minimizing removal of otherwise normal, healthy skin.
Mohs surgery is preferable to other procedures because it's tissue sparing, and it also has one of the highest cure rates around of the skin cancers.
Performed under local anesthesia, Mohs is a delicate procedure that should only be performed by a skilled surgeon. Removing the cancer piece by piece, the patient remains in surgery until the doctor is sure all of the affected tissue has been removed.
The process involves the tissue being taken from the patient, which is then brought to the lab, where a histotechnologist takes that tissue, stains it, makes a slide out of it, which is then brought back to the doctor, who examines the slide under a microscope to make sure that the wound edges are clean and clear of tumor. Once that's the case, the patient then can have his defect repaired.
James underwent the Mohs procedure, and today he's cancer-free and taking steps to reduce his risk of a recurrence.
Today I feel great. There's no problems at all. There's a lot of people that are afraid to check things out like that, but my advice is to get it checked out as soon as you can to prevent anything that it could develop into anything worse than it really is. And most of the time you do get it checked out and get taken care of, as in my case.